Oh, so many people are living this reality. Late summer is often a very frustrating stretch for anybody who suffers with allergies.
And this year, some of us apparently having a worse year than the past. So what's the reason? We asked our health specialist, Beatrice Politi, to look for the answer tonight and some relief, hopefully.
Well, some of us are more susceptible when it comes to the air we breathe. I know that I am one of them, especially now that it's ragweed season. But scientists say this summer there's more mold and ragweed to deal with. And yes, they're blaming at least part of it on the weather.
Marcia Russell loves spending time outdoors, but knows her summer allergies will kick in again with ragweed season.
Last week in August, which is next week, through to probably mid-September, I'll be itching and scratching and having to use my medication.
Different months mean different allergens. In June, it's tree pollen. In midsummer, it's grasses. And now, it's time for ragweed. The somewhat soggy summer has meant a measure of relief for some.
And I think with the extra rain we've been having this year, that tends to keep my allergies down. Perhaps it keeps the pollen levels down.
Rain makes pollen sticky and keeps it closer to the ground. But it's not all good news. More rain also means more mold, which is an allergen itself and which can make other allergies worse. And all those trees, grasses and weeds love a good soaking too.
A wet summer with very erratic weather patterns has definitely increased the number of pollen-bearing plants releasing their pollen and people becoming allergic.
The more erratic the weather, the less likely allergy seasons will be clear-cut.
People show up in other periods of time rather than at the peak time when we expect them, and we may not really recognize them appropriately as being a tree, grass, or ragweed allergy.
Allergies can develop at any time in life. So before you dismiss that sniffle as a summer cold, think on whether that so-called cold happens every year around the same time. The only way to truly diagnose an allergy is allergy testing.
If we can get in early and get in aggressively and control the allergies, we can prevent those allergies from getting worse, other allergies from coming on, and even prevent the development of asthma in some patients.
There are a lot of over-the-counter medications out there, antihistamines. Though the allergist I spoke to today told me they do help with the symptoms, the best thing is to go to an allergist, find out exactly what you're allergic to and how high your sensitivity is, to seek a solution to treat that allergy. In treating that one, you'll help prevent the development of other allergies and asthma. There's something that's called an allergic march. So once you've got one allergy, you're more likely to develop others.
You know, we have good friends of ours who are actually trying to plan their wedding around the fiancé's allergies.
Oh,
absolutely,
no.
because they're so bad this time of year, and like they said, the areas are crossing over now.
We have a title for that. It's called High Maintenance.
Oh, no. I'll tell Michael you said
mean.
so.
So mean.
But we are heading into what we call high season for allergies.
Yes, absolutely. It's called the September asthma epidemic. Research has actually shown, Canadian research has shown, there are more hospital visits in September for asthma, mainly in children, but adults as well. Doctors aren't really sure why that is yet, but they believe it may have to do with all of us being a little more lax over the summer, particularly when it comes to allergy control. We tend to be more lax in the summer.